and this is the center of Elizarov, where I did 3 times a postdoctoral fellowship, and this is our biggest naturally institute hospital, 1,000-bedded hospital, and at present I'm working here at the diabetes hospital, 1,000-bedded, situated in Dhaka, and this is my center. This is Elizarov, man, meat, method, and magician, and hereditary multiple exostosis. You can see here the genetic disorder, benign bone tumor. You can see here the common signs and the symptoms, physical deformities, joint issues, pain and the disability, and this is the single classification by Masada Uno. And you can see there are 4 types here, type 1A, 1, 2A, 3B, and type 3. You can see in the right side, and this is, you should have to know before putting the Elizarov, the safe corridors, and this will be the position of the forearm, and this is the device application of Elizarov with the forearm, and this you must know all these things. And let us see some case illustrations. You can see here. This is a very difficult case. If you don't know the Elizarov technique, you cannot handle this kind of cases. Look at this 12-year-old girl, and what I have done, put the Elizarov only with the multiple biocompatible thin waves, and then after 5 months, you can see here, this is the follow-up, gradual destruction, and clinical appearance after 7 months, you can see here, and this is after the treatment. Just you compare left side to the right side, and this is published in American Journal of Medicine. And case number 2, you can see medical student, elbow deformity, migration of the radial head. You can see here gradual destruction, and look at the ulna, and at the same time the radius, bowing of the radius, shortening of the ulna, and this is also again the biocompatible thin waves with 1, 2, 3 frame construct, and this is the final correction. You can see clinical application of the patient. And this is case number 3, again diabetes classes, and you can see another name is Ehrenfeit's disease, all multiple exostosis. You can see the clinical appearance, and this is the during treatment, gradual destruction with the Elizarov frame with the biocompatible thin waves, and this is the after treatment and the clinical appearance and the outcome of the patients. Now another case, you can see here clinical picture of a 6-year-old girl, and you can see here before treatment, during treatment, and this is the final follow-up, which was also published in American Journal. And this is the, see, when you are putting the Elizarov, you must tell your patient do all the time the physical exercises. The fundamental principle of Elizarov methodology is load and motion. And you can see what they are doing. And these are the things all the time. The patient with the dumbbell and doing the exercises. And at my center, I am doing the lengthening. This is the Chinese, the foreigners, those who are coming to my center for getting treatment. And confidence is always better than perfection, because perfection means doing the best, but confidence means how to handle the worst. So there are 3 kinds of people in this world. 1, people who make things happen, people who watch things happen, and people who wonder what happened, which category do you fall into. So these are the cases that is very, very difficult to handle all the time. So these are my published books since 2008, 8 books, and lastly, carry home message, dear friends. I always show this because you must have the evidence that what I have showed you is science and on the basis of the art and surgical skill of the surgeons. So thank you very much. I finished within 5 minutes.